cold extremities, dry or coarse skin, constipation, cold intolerance. So cold at times, people say, well, I'm hot, I'm not going to be low thyroid. Well, if you're low estrogen or you have a chronic infection, you can be hot. And sometimes you're hot and cold. So either it's too hot or too cold. That's usually low estrogen and low thyroid or a chronic infection as well. Hair loss or dry hair, typically hair loss all over is low thyroid. Poor memory, poor concentration, hoarseness, water retention, anxiety, lack of sweating, weakness, pale skin, shortness of breath, palpitations, so heart palpitations, PMS, heavy menstrual flow, muscle or joint aches, hormone aches. So some of these sounding familiar. And pain or someone feel like something's there. You can get scans if they're all normal, and a lot of times that's low thyroid. So what do you see on a physical exam? Overweight usually, but underweight also, especially with adrenal insufficiency. People say, oh, you can't be low thyroid, you're skinny. No, that's definitely not true. Again, the hair loss, dry, brittle hair, puffy in the morning especially, large tongue. People say, that's fun, I bite my tongue and it feels like I got marbles in here. Swollen thyroid, brittle or slow-growing nails, dry skin, cold extremities, dry heel. And a lot of people with low thyroid, though, have the stones and the razor blades, and they're just, and the lotions, and that will go away with physical body with thyroid. Low basal body temperature. Basically, think of the thyroid as the gas pedal, and all the engines, all these cells as little engines. With the thyroid, without thyroid, they don't rev, they don't generate any heat, so you have low basal body temperature. The symptoms are often dismissed. They say, oh, it's just part of C-fits, or you're just depressed, you're just getting old, just stop eating so much, just get out and exercise, you'll feel better. Hear this all the time. Your doctor will say, you cannot be your thyroid because your thyroid is fine. We'll talk about how wrong that is. There's a 10-year study of fibromyalgia patients, 92 patients. They found that 10% had primary hypothyroidism. Now this is the ones that the doctor will pick up. The TSH gets elevated. It's like, oh, your thyroid's low. But 45% had central hypothyroidism. The pituitary was dysfunctional. TSH stays low, never picked up by the doctors. 34% had thyroid resistance. What is thyroid resistance? It's basically the thyroid's in the blood, but it's not doing anything. So that is not picked up on any blood tests. Okay? So basically 90% of the people with fibromyalgia had low thyroid, with less than 10% would be discovered on standard blood tests. So the incidence of primary hypothyroidism with fibromyalgia was 2 to 10 times higher than general population. Again, this is the one that would be picked up on the blood test. Incidence of central hypothyroidism, not picked up on blood test, was 250,000 times higher than general population. And the incidence of thyroid resistance was over 1 million times greater than general population, not picked up on blood tests. So here's cartoon, it sounds to me like you're just a little depressed. So, we'll do a little physiology here. You'll become experts on the thyroid. It's the pituitary in the brain tells the thyroid, okay, by secreting TSH, thyroid-stimulating hormone, to produce T4. T4 is not active. It requires the body to convert to T3 to be active, and you have an effect. But it can also go reverse T3, which actually blocks the thyroid, okay? So T3 goes to receptor, stimulates it, you have an effect. Reverse T3 is called reverse T3. It's the same compound but backward, like a mirror image, like a right and left hand. So it goes there, sticks there like a false key, and nothing happens. Well, that's bad, but it's worse now because no active hormone gets the receptor. So it's blocking out the thyroid. People say, why did my body make that? It makes no sense. Well, it does in an evolutionary manner because our ancestors who were starving and famines and sick, they could live less food. Good for them, not good for us. So basically, what do doctors check? This, almost always, sometimes this. This is what matters, this ratio here. Sometimes you can check that and say you're fine, but what really needs to be done is this ratio of that reverse T3 to T3. What happens a lot with CFIDs and fibromyalgia is instead of the body converting T4 to T3, it goes over this reverse T3. So you, instead of having thyroid in your blood, you have all this blocking thyroid in the blood. No one ever checks it. And it's a big, big problem. Okay, so standard blood tests are usually normal. The CFIDs have hypothalamic pituitary dysfunction. So basically the standard blood tests that are based on these normal pituitary functions, so they cannot be interpreted the standard way. You have to use different tests, different reference ranges. And so here's good news, you're testing the TCA range. This is what the fine, oh, you're fine, it's not your thyroid, forget it. Yeah. Very true. Okay, so the standard traditional way to diagnose low thyroid, again, is based on that elevation of TSH. When the pituitary says, come on thyroid, get going, start doing your job. But the problem is it misses 80 to 90% of people with CFIDs and fibromyalgia. And also, some people say, well, I'm already on thyroid. Well, the dose will be totally wrong because they also base the dosing on the TSH. So, totally erroneous results. So you basically don't get adequate doses. So you can walk in also complain with numerous symptoms of low thyroid. 90% of doctors won't treat because of the TSH is normal. Okay, so individuals can suffer for years being told their thyroid is fine, but more specific testing will often reveal that thyroid is low, and supplementation will be beneficial. Often remarkable results with significant improvement or resolution of symptoms, including the fatigue, muscle aches, brain fog, weight gain, etc. So now, studies show that really with any sickness, inflammation, physiologic stress, that will suppress the thyroid function. Now, the more severe the illness, such as C-fits and fibromyalgia, the more severe the depression. And again, but it comes from the pituitary. There's also more reverse T3 made, but the majority is the pituitary, so it's not picked up on the standard blood test. So basically, all patients, because they're sick, have suppressed thyroid. This is a Journal of Clinical Endocrinology and Metabolism, Journal of Clinical Investigation and Endocrinology Investigation, all showing that. So why are the numbers of C-FIDS and fibromyalgia patients just going crazy? It's just taking off, multiplying it every day. Are toxins and pollution a factor? Let's look at toxins and their effect on the thyroid. Flame retardants accumulating in people's bodies are blocking thyroid effect. This was even on 3 months ago, front page Sunday section of the LA Times. We're talking about this fire retardant that is of course banned in every other country except the United States. In our infinite wisdom, it has to be in everything in the United States. It's in this table, it's in the carpet, it's in the clothes, it's in everything. And they're worried because what it's doing is blocking brain development in babies. How is it doing that? It's blocking the thyroid receptor. So the baby's brain isn't getting enough thyroid. So they say, you know, how terrible this is, there needs to be something done. What about all these people with thyroid in their blood? It's not doing anything. And so, maybe back down was Toxicological Science 2000. Organic chlorine compounds lower thyroid. That was Environmental Health Perspectives 1999. PCBs and cadmium lower thyroid levels. Environmental Health Perspectives. Synthetic chemicals block thyroid effect. Thyroid 1999. Pesticides and industrial chemicals decrease thyroid levels in the body, that is in thyroid. And thyroid levels in alligators in 3 lakes correlates with the degree of lake toxicity. And what it is, they found there were 3 lakes, and then one lake was kind of toxic spill, very dirty. Another lake was, it's kind of dirty, but not too bad. And one lake was very clean. They checked the thyroid levels in these alligators. They found it was very low in the toxic lake, medium in the medium, pretty good in the clean lake. But they all have the same TSH levels. So pollution, toxins, big problem. So again, if you're already taking thyroid supplementation, most people are on Synthroid or Naloxone. They're not adequate for the majority of C-FIDS and fibromyalgia patients because of that trouble converting that T4 to active T3. Some people are on Armor. It's better than Synthroid, but it's pig thyroid, and there are some differences. And we actually will do a test which actually checks the body, so when you start taking the Armor thyroid, the body doesn't recognize it as human, start attacking it, then you have antibodies not against the thyroid, but actually against the T4 and T3 molecules. And it's a big problem. So we'll actually check that, and we find that the anti-TSH, anti-T4, and anti-T3 are often elevated in people on Armor thyroid. And so that's the reason why we stopped using it about 4 years ago. There's also the possibility of disease transmission. You know, there's mad cow disease, there's also mad pig disease. There's a push to take glandulars off the market. Now, Cytomel is okay, but it's very short acting. You get a lot of side effects. It goes up and down. You take the dose, and you get a lot of complications, and then it goes back to low. So time-release T3 is the preparation of choice. that reverse T3 the best and overcomes the thyroid resistance?
Like time release settlement.
Yeah. So here's thyroid meds, one size fits all. One size fits all, trying to stick it on there, and that's the problem. So T3 also stimulates serotonin production. And you can put T3 head to head against antidepressants, it's going to beat them. Okay. We get many people off these SSRIs. Okay, so why are T4 preparations, depending how bad they are, why are they become the industry standard? Only because of mass market. Again, use of these preparations are inadequate for the majority of C-foods and fibromyalgia patients. So again, just that review, doctors are going to be checking this. We have the block. Here to the active T3, too much reverse T3. And we'll talk about the thyroid resistance a little more. So, what is thyroid resistance? Basically, thyroid's in the blood could look fine, but there's no effect. Sometimes it's even high. So the thyroid receptor can be blocked secondary to toxins, genetics, hormone deficiencies, nutritional deficiencies, or infections. All those will block the thyroid receptor. It's a clinical diagnosis. There's no blood test you can do to say you have thyroid resistance, but a lot of tests can give you clues. You can remove the resistance by removing the problem agent, being the toxin or the infection, or replacing the deficiency. And oftentimes that's what we do when we are phase of treatment. You can overcome the resistance with increasing levels of T3. Again, you can't go by the blood test when you're doing this. Possibly also improve with inositol. There's some studies showing that you can overcome the thyroid resistance with big doses of inositol. Here's a study, the metabolic basis for fibromyalgia and related disorders, the possible role of resistance to thyroid hormone. Okay. There's quite a few studies coming out on that. So let's bear with me. I'm going to just do a few quotes from some medical journals. Quote, that most euthyroid, so normal fibromyalgia patients improve or recover only with supraphysiologic doses of thyroid, so very high levels, not normal levels of thyroid, supports the likelihood that the underlying condition is a partial peripheral thyroid hormone resistance syndrome that is due